Hi, Dr. Srivats. Welcome to the podcast today. It's a pleasure to have you on the show today. For the sake of the audience, let me do a quick introduction. This is Dr. Srivats Bharadwaj, a pediatric preventive and special needs dentist, and he runs a charity known as Vatsalya Oral Health Foundation. He's an educator, innovator, and mentor who has played a significant role in the space of healthcare. I'll leave it to you to introduce yourself.
Thanks, Vaishnavi. Yes, it's always a pleasure to be on your show and to kind of share my experiences or my thoughts about healthcare and where we are, where we were, and how we are progressing. So pleasure and happy to be a part of this show. Thank you for inviting me.
It's our pleasure. Today I'd like to talk about medical education across the globe and in India as well. So first off, you have been in the medical education space for quite a long time, being a professor yourself. How do you see the different systems of medical education across the globe and how do they compare?
Well, that's a very good question. And to begin with, having traveled far and wide across the globe for educating myself as well as imparting knowledge of whatever little I know of, it's been a great experience, but honestly, I feel that there is a big difference in the approach to learning and teaching, as well as that automatically translates to the practice of medicine, right? So to give you a very simple example, what I mean by the approach is because currently at this point in our education system here in India, we are at a very nascent stage where we are not yet completely imbibing the philosophy of, let us say, problem-based learning, right? So we still go by learning subjects and try to answer questions that are given to us and learn through that. Whereas when I did look at and also taught at a few universities outside of India, our curriculum was designed more on problem-based learning, right? Which makes a whole lot of difference. And then something else that I always am for is that we learn by subjects. Whereas an ideal way for me would be to learn by an organ. To give you an example, we study anatomy, physiology, biochemistry, and then go on to do pathology, microbiology, medicine, surgery, and so on and so forth we learn. But imagine a situation if I gave you the cardiovascular system and taught you the anatomy, physiology, biochemistry, surgery, medicine, pathology, microbiology, all of that of one particular system, right? So you can understand it from a comprehensive viewpoint, as well as when I propose a problem to you as a student, right? Wherein instead of me asking you a question, Vaishnavi, can you please name the artery that supplies to a particular organ? Would you be able to tell me the course of this particular artery and how does it help the person, right? So you go on a ascending process of learning. Whereas if we go organ based or a system based learning, what will happen is that you will come descending, right? So and also it better prepares you to be a good doctor, because nobody in your clinic when you get on to practice is going to come and tell you that I am diabetic, treat me. Because a lot of our questions in our exam papers is, can you describe diabetes, signs, symptoms, investigations, and treatment, right? But no patient is going to come and tell you that. He's going to come and tell you that I have, a particular symptom, and that started from this particular time, and I am so and so of age, and I am this, kind of a thing, which you have to construct in your head based on the knowledge that you have and come to a diagnosis. This is a sudden jerk that a student will face, and that's the basic barrier for less confident doctors today. Because imagine a system in which that we are trying to teach you from day one about signs, symptoms, and then intrude your own brain to think, okay, why is this person thirsty every night? Why is he going and using the restroom every night 5 times? Is there tiredness in him? Then, things start ringing bells. And finally, whatever limited knowledge you may have, but it's still true, right? Imagine you may first think that, okay, he probably drank a lot of water and went to bed, right? That's also the right answer. So you will not miss anything and continuously learn, but ultimately, maybe the next trigger that I give you would direct you eliminating certain aspects. And that is the art of interviewing a patient as well. And this is a big difference that I find in the approach that we must have today in the Indian medical education system, because we will make young doctors or even doctors better prepared to take care of their patients. And that also automatically builds rapport. That continuously gives you automatic thinking as to what is the reason why he's thirsty. Can I ask him some of these critical questions? And that is where the conversation happens around the life of a person, the lifestyle that he's leading. Because doctors today, by and large, are imagining that, well, a person is coming and I'll put him through a battery of tests, not even understand what is his behavior, what is his nature, what is the kind of role, job that he has, how's his family. All of this plays a significant role in treating a particular person, because you're treating a person with emotions. You're not treating a condition that's just stuck to his body, which you think that you'll go and operate or kind of treat that. So my approach to teaching would be this. And I'm hoping there is a huge amount of focus today in our Indian medical education also to make it better, and applauds to all the people who are trying to bring that into picture. But yes, we do have a long way to go, and I'm sure we'll get there.
Yeah, just a quick follow-up. You mentioned the thirsty patient and them going through a battery of tests. How much should medical students be taught to rely on tests versus the knowledge and experience that doctors have?
Well, great question, actually. In my opinion, we have reached a stage where we have made to believe that tests are going to give you the best answers, right? But that's not true, because there are no two people who are similar, right? There are no two conditions which will be similar. And in the 27 years that I have practiced myself, I haven't done a particular procedure or a surgical intervention which is exactly what is mentioned in our textbooks and how we have learned it, because the approach to it would be different. The preconditions with which the person comes is different. The sensitivity of that particular patient to a particular procedure is different. So that is not going to be done just by testing. That is going to come by you understanding the science of human skills. Because as a doctor, the greatest skill set that a person must have is human skill, which is to understand who's your patient, what are his requirements, and a lot of times patients don't speak their mind, but your ability must lie in actually making them comfortable so that they open up and actually tell you the truth. And so you can go to the problem per se at the core of it and heal it. Answering directly in terms of what percentage should you rely on, I would rely on understanding what his symptoms are, what his signs are, and where is it coming from through a very detailed interview on understanding the person who is sitting in front of me, and come to a conclusion or come to a diagnosis. Because every particular disease has a particular sign, has a particular symptom. And if you are able to be knowledgeable enough, and if you have invested enough amount of time through sensitivity and intuition, because medical science requires this intuition. Good doctors are the ones who have the blink, who have intuition. Their knowledge comes at the right time, and that intuition is the way to practice medicine. You do investigations, but not to come to a final conclusion just by that. But you understand and then come to a diagnosis in your mind that this is what probably this is, and then you investigate to confirm, as well as to see if there is something else that you have missed. And a lot of times we have to appreciate investigations, because you will see conditions that neither you thought of nor the patient actually perceived it was lying. So many times. And that is the beauty of this medical practice.
So what you're saying makes me think that students need more clinical exposure.
Oh yeah.
And how is the system in India right now? How much classroom exposure are they getting? How much clinical exposure are they getting? And what can we change about that?
I think it's pretty lopsided to more of theoretical learning currently. And I think the clinical exposure, like I mentioned, should start from day one, right? Let me give you an example of dentistry. right? So during our first year, we studied biomaterial sciences, which is what are the different kinds of filling materials we have, the composition of that, and how it's manipulated, and so on and so forth. But then we are barely coming out of our 12th grade and have no clue. The only science that we studied of the body was botany and zoology, which hardly play any role truly in your medical sciences. So it's like you've taken me from let's say one particular place which has full water and greenery and put me in a desert, and I have to fight that through. And all that you can do is just mug up and rut. And that was a disconnect that I personally went through as a student, because I would question every single thing. I would question my teachers, asking them, why are you teaching me this? And how is this related to what I'm going to do? Unfortunately, most people couldn't give me those answers. We had some fantastic teachers. But then, unfortunately, the system is driven that they would say that, no, you go back to your final year and that's where you learn how to do a filling. Right? And I would wonder, why are we dividing a particular cement that we are going to use into 4 parts, and some other cement into 6 parts, and some other cement into 12 parts or 8 parts? And it made no sense to me, right? Imagine if I'm going to teach you the theory of a particular cement, even before I teach you that, what would it be if I take you to the clinical aspect of it, take you to actually the clinical side of the, of the teaching part, show you a person being filled, a person going through a filling on his tooth, and how the manipulation of the cement is happening, and so on and so forth. Then your curiosity comes in to learn, what cement is this? What is the constitution of this? Why did we do 4 versus 2, in terms of the parts that we did? And then if you come on to learn, you have a visual field, you have a perfect perception of why you're doing what you're doing. And that's the unfortunate reality. Imagine if you have to teach the science of, let's say, gravity, right? How do you teach it to a person? Just like the way we learn numbers? Not at all, right? Imagine if you show a child an aeroplane that's flying and then tell, this is an object that's flying and people are sitting in it, and he'd wonder, can I jump and can I go there too? And then he starts questioning, and then you teach them that, this is how the science behind it works. So that is the big change that we need to cultivate. I don't know why we restrict first years and second years from getting into clinics. You would learn better. You would be a better communicator. You will understand the flaws and the positives of what you're doing and why you're doing. And then you're giving a chance for improvement, because you have 5 more years ahead of you to think about what you did and why you did it. Mm-hmm. And this is what I would think I would do this in a different way.
Mm-hmm. From a student point of view though, what can a student do? Do they have any resources?
Well, yeah, I don't think I should be answering that question at all, because where there's a will, there's a way, right? So we studied in an era where there was no internet. It might be hard for you to believe, but we had no computers, right? We had no internet. And where would we gain resources? By going meeting people who had knowledge, by writing to them, and trying to seek knowledge, or trying to make the effort to go and reach out to such people. Today, everything is available on the internet. Everything is on this device, which is called the mobile phone. It is just how you direct your energy, and that determines your attitude. And this is one profession of medicine where there's no compromise. I strongly advise young students who are studying their school right now, if you want to be a doctor, don't compare yourself to any other profession. That's true for all professions. But then you can't get the comfort and convenience that a lot of youngsters get passing out into IT and, sitting there. Yeah, they earn tons of money. There is hard work. It's definitely difficult for a person like me to sit on a computer and work for 15, 16 hours. I do appreciate that. That's a different kind of skill set and hard work that you need to do. As a doctor, there's physical labor, there's mental labor, and there's a lot of stress, because you're taking the risk of somebody else's life. And so when you are in such a critical job, you cannot have the attitude of being relaxed. You have to be obsessive at every single thing that you do. Things can still go wrong, but you can't beat yourself up for that. But you can still think, what did I do wrong and how can I correct myself, right? So this is something that we must. Another thing that I would strongly suggest, apart from the student thing, is what do you think should change in medicine is probably a whole different way to look at things, right? We are today talking about evidence-based medicine, right? And we are relying on people who are writing articles with experience and with skills, who probably think what they did was right and they're publishing, and we're all going through that and learning. Great. But imagine a scenario where I would say that every hospital, every medical school has a team of people who are just simply observing what people are doing and what is the outcome that is coming out of that particular activity. And if you can map that, and today with tools like AI and stuff like that, you can map that I did these 5 things in a particular person and this led me to this particular outcome. So can we completely make everything foolproof? No. But can we close that gap by using technology and people as human resources who are actually watching you, so they can actually add to the quality of care that we are providing. And I would like to see something like this in place. Imagine if I'm working on 50 patients every day, somebody's watching me and giving me insights at the end of the day that you did this and this was the outcome. And so let's say after 2 years, I'd have a pattern to my work. And so I'd know where I can change to get things better. Mm-hmm. That's so very essential.
Yeah, I understand that a lot of facilities today are focused more on the maximum volume of patients that they can treat and less on the patient experience. So what are your thoughts about that?
Oh, well, unfortunate to say this, because we build 5-star hotels for a great experience where we go and live and we pay tons of money. But the hard reality is that sort of investment must actually go into healthcare. When you build healthcare facilities, it's all about how the patient is feeling, right? Recovery and healing does not happen just because of you prescribing great medications, right? The stay there has to be as great an experience, which gives that power for that patient to actually feel alive. The patient should actually feel that I must get well. And if we are not creating such ecosystems of healing, we're just creating dumb things where people get discouraged. And that's the fundamental reason why people are scared to go and visit healthcare facilities. Look at what we've done. We have started to scare people with diagnosis. We've started to scare people with intervention. We've started to scare people with investigations. When and how are we going to change? None of us are thinking, and we're just running off in that particular direction. And poor patients who are gullible to information, who have no other way because they're just scared, coming to us, and then we hardly touch our patients, right? We hardly communicate with them. We don't understand that they are a body of emotions. Forget about them, look at their family, right? So this is what, as a young doctor, I think most people who are youngsters should start involving themselves right from the design of your practice, right from the design of a hospital, right? Which starts giving them a better healing experience, isn't it? I was just thinking a few days ago that the term nursing home has almost gone. Like everybody wants to put up a hospital, isn't it? But just if you go back and think about the term nursing home, look at how wonderful it is. Today, if you tell somebody that I have a nursing home, it feels like, oh, you're an unestablished, unregulated, small-time practitioner. But if you look at the term, it's a nursing home. That is what hospitals should be. Our healthcare facility should be. Right from the way we address people with conditions should change. Is there a better word that we can address our patient population instead of saying you're a patient, you have this disease? We have to have better sensitivity when we talk to our patients. Nobody likes to be called something, right? It pulls down your confidence. So is there a way that we should rethink terms and terminologies and the way we are even meeting our people who are coming into our clinics with certain health issues, right? And do we as a doctor have the capability to handle them? That should be our thought process. The way a doctor is dressed, the way a doctor behaves, right? All of these things make an impact on a person. If you look back as in your childhood, when you're growing up, you have certain role models. You don't know them. They may be your neighbors, you've never spoken to them. They may be some random person, but you'd think, I want to be like him. right? Why? Because he's dressed well, he's behaving dignifiedly, his mannerisms, his ability to speak well, and compassion, empathy. These are things that one must have. And the ability to understand that somebody in healthcare can be rude because of the pain and discomfort they're going through. So, do we have the time to sit with them, hold them, and understand what they're going and give them an assurance that we will stand by you, right? Unfortunately, nobody is understanding the spirit of practicing medicine. We're all diverted towards practicing by the letter of the law and not by the spirit of the law. That is the fundamental difference. And I'm very scared that 10, 15 years from now, we will hardly have good doctors. We will hardly have people recovering. We'll hardly have patients who are actually happy that they went to a healthcare facility and they can call up their friend who is a doctor, a coach who is their doctor, a mentor who is their doctor. That is the day that medicine will improve. That is the day we will actually see recession of disease pattern. Today, you just look at it. What bothers me is the super specializations and the specializations that are just churning out, right? What does that mean? That means that somewhere we are not doing right things. A doctor is a person who should be paid the highest when the population is healthy. How contradictory it is that the patients think that this man or this lady is going to heal me, and we are thinking that why are people not sick? Because my business would run only when people are sick, right? So it's a dichotomy in my head that on one side you want people to be sick so that you make your living, and on the other side you have patients who are thinking that you're God. So truly, to me, I always used to tell this to my students that medicine is one branch of science which actually is like a person sitting on a branch of a tree and cutting it. The goal of medicine should be to see its own end, not to create more disease. That is the goal. We today talk a lot of things. We'll do preventive health check. But the preventive health check, nobody is sitting and talking to you about your life and lifestyle and what you really do. It's about drawing your blood, running you through treadmills and tests and catching some problem and trying to intervene there. That's not preventive health check for me, isn't it? Mm-hmm. So that is where I think not just the people who are practicing medicine, the regulators in medical fields, plus all the common population must also understand and give an opportunity for doctors to actually allow them to treat them in this way. Otherwise, it's just all about intervention, and we are creating suicidal methods of doing this. It's neither going to do good to doctors, nor is it going to do good to patients.
Yeah, I completely agree that altruism is obviously or often over-trumped by the money-making aspect of medicine. But what are your thoughts about the rising costs of medical education itself? Is that causing doctors to have this sort of a mindset?
Well, not really incomplete. That probably gives a sort of image that it's the rising cost of medical education. And I do agree that money is required for everything, but there's a way to earn that, right? It's not just all about money, because unfortunately, the places that you may live in do cost money, right? So either we have to go back and relook at how should medical facilities run. Should they be established by governments and then handed over to a private player who can run them so that you can cut down the costs or the expenditure that is coming by? Or there are other formulas that you can apply. So as far as medical treatments are concerned, at least in India, we're not expensive. It's a feeling that people have, because unfortunately what happens when you say that it's expensive, it's a human behavior. Everybody wants a discount. Everybody wants to look at how can I just say that it's expensive. It's like going and bargaining at a shop. So our attitude towards medical care has also become that way, right? The day you value your life, everything else becomes nothing, right? So just imagine a situation where somebody is calling and saying that it's a bad example, but I'd like to say this. Just imagine some guy kidnapped somebody's son and he says that you give me 1 crore, right? and I'm going to let him go. Would you negotiate with him? No, right?
No.
So imagine this is your life, right? This is your life. And the moment you go and tell healthcare providers, give me discount, if there is no way that they could do that, right? What are they going to do? They're going to shortchange. And what is shortchange? Is defensive infection control protocols, right? Imagine there is a cost to doing a particular thing, and India is the cheapest or one of the cheapest places where you can get the best healthcare. Indian doctors are simply great. The knowledge, the exposure, the hand skills, and the ability to work hard, Indian doctors are second to none. In fact, they would top among the best professionals in the world today. The problem is that there's a huge amount of pressure on doctors today to kind of keep working relentlessly. And when we as doctors are looking at good outcomes for our patients, and then comes the stress that how do I cut costs for my patients? Do you know, I have thousands of friends who are doctors, and each one of them burn themselves every single day. We should have conversations about what's happening in their lives, right? And apart from focusing on hardcore medical care, doctors are under pressure trying to make calls to people to reduce costs. Can you do this for me? Can you reduce the price for this and that and stuff like that? But the blunderous thing is, and when we go out and see people are randomly buying expensive things, expensive gifts, expensive jewelry, expensive malls, shopping, all of that, right? So we need to create this balance, and that will come by our value system. So if you can afford, it's better that you go and tell a doctor, you know, I trust you. Do the best that's possible. Because if you don't have health, you can't function. Your business will shut, your work will shut, everything is gone, you're gone. So that is the most prized thing that you have in your life, which is your own health. And I do feel a lot of times that we must somewhere communicate this, right? So there's probably 0.001% of doctors who may be greedy, because they're also human beings, and you can't blame them, because their life experiences might have taught them something in life. They may be coming from a different sort of mindset. Their experiences could be different. But in my knowledge, in the last 27 years, I've seen doctors far and wide across the globe. I'm yet to find somebody who's actually just blatantly commercial. It's not them. Rather, you can probably blame a part of it on a system, where we go beyond a certain means to provide care on a larger platform, like establishing something of a huge kind of a corporate hospital system and things like that, where you have people who don't understand healthcare trying to govern healthcare systems. That's a problem. The need of the hour is doctorpreneurs. Doctors who actually run healthcare facilities, because they understand care. They understand care, and care is beyond Excel sheets. Care is beyond numbers. That is when it will improve. Not everything that you want in life is given to you on a platter. There are compromises that we all make in life. And one big compromise that probably all these people who are running healthcare facilities must do is not compromising on, or not shortchanging on, infection control, not shortchanging on the required set of investigations to be done, not shortchanging on the time spent with our patients, and then come and say, this is what can happen with this. That's what it is. Our load of patients will come down over a period of time if we actually practice medicine in the right way. Because the doctor is not having time to actually say the right things to his patients. He's just saying, okay, continue this medication, come and see me after 3 months. That's only going to burden people far and wide, right? That's not healthcare to me.
Well, those are all really valuable insights. I'd like to end with one final question. What would you like medical educators and students of medicine today to leave with this podcast?
Well, I think fundamentally passion to practice, the desire to help a human being who's suffering is the basic ingredient for a doctor. This profession is not defined by the number of hours that you're available to your patient. This profession is defined by all-time availability to your patients. Giving access to them, to your life, is the fundamental requirement in this profession. And not comparing how much you earn in this profession and compare yourself to somebody else is the fundamental basics. If you follow these principles, you will be peaceful, your patients will love you, and the most important thing is the gratification and the satisfaction that you will have when your patient acknowledges and thanks you for rehabilitating him from his health crisis is immeasurable. And the hormones that get released in you will give you good health, joy, happiness, and continued success.
Absolutely. Thank you so much, Doctor. It was a pleasure having you on the show, and we all definitely gained some very valuable insights from this conversation.
Thank you so much, Vaishnavi. It was a pleasure to be on your show, and I wish you all the success and all the best.